So medical tourism is when patients seek medical care outside, typically of the country. The principal driver behind that is cost. If someone doesn't have a procedure covered by insurance or they feel they can get it done cheaper, they may seek it elsewhere. The clear problem with that, in my mind, number one, is follow-up. These, particularly with regards to bariatric surgery, it's essential that someone follows up in a short and long period of time, with their surgeon or with a group that is going to follow them closely for any potential complications that can occur. It's just a much safer way to go to have that follow-up. So that is lacking in medical tourism. Also, when complications do occur, if they occur within the first several weeks, they often need to be treated immediately or at least as soon as possible to minimize negative consequences. That kind of attention and immediacy can occur here in the U.S., but is not as likely to occur, obviously, if someone goes out of the country for that.
You can go to Mexico and have a procedure done and then go home the next day, but you don't get any of the teaching before surgery, you don't get any of the follow-up care after surgery. And what we find is when people don't have consistent follow-up with their physician, they have more complications. Recently in the news there were 12 to 15 people that had severe wound infections, and they were all traced back to a hospital in Tijuana where they'd had a gastric sleeve performed. Those people, when they came back home, had to go to their local emergency room and get treatment for that. Insurance will not pay a dime for those complications, and those people have to pay the entire bill themselves. One woman said that she was losing her house. That's a pretty big risk to take. When people come to us here in the United States, again, we're here to help them from the moment they walk through the door until years down the road when they're doing well on their own. Any complications that arise, we intervene early to prevent that from becoming a huge problem.